My interest in the neurosciences started with the question why? Why do people do what they do? During my undergrad in neuroscience, I learned the simple truth that our brains control all our reactions, all our likes and dislikes, what we say, what career we choose, who our friends are, and everything else in our lives. Through my graduate studies in psychology and my training in neuropsychology, I started learning about what happens when the brain fails to do what it is supposed to do. If one little part of the brain doesn't work well, we have difficulty recognizing faces. Or if another part malfunctions, we will see and believe things that are not real. Each part of the brain has a role in our functioning. I became more and more passionate to continue learning as I joined KEM Hospital to train under the guidance of the best neurologists and neuropsychologists. I joined Just Look Hospital as part of the neurosurgery department and have been lucky to be a part of a team that brings new advances in functional neurosurgery to India. Since I began consulting at Sir H.N. Reliance Foundation Hospital in the neuro rehab team as well as the neuroscience team, I have had the opportunity to design new programs related to dementia care and brain injury support, as well as conduct seminars for doctors and awareness lectures. I began creating programs and organizing workshops to teach different aspects of brain health. I ventured into working with various age groups, from conducting an after-school program with 5 to 7-year-olds at Cathedral Infant School to weekend camps for high school students at Bombay International School, as well as developing and teaching a semester-long course on neurocognition for the master's students at SNDT University. And then I founded Synapsium Brain Health Care in 2013, which has grown to a size larger than I ever imagined. We are a team of highly trained psychologists providing specialized psychological and brain health care. Over the years, Synapsium has provided over 1,000 patients and families with over 50,000 hours of care. At Synapsium, mental health is the same as holistic brain health. We take the time to understand each client from all facets, from psychological, emotional concerns to physical health problems, family dynamics, as well as occupational productivity, and also by liaising with our medical professionals whenever needed. Synapsium is your one-stop solution for everything related to the mind and the brain. People come to us for Alzheimer's and dementias, Parkinson's, epilepsy, memory and attention problems, strokes and other brain injuries, sleep disturbances, poor productivity at work, family discord and relationship issues, depression, anxiety, OCD, bipolar, and other concerns. Some of the most common consequences of a brain stroke: anxiety, depression, and anger outbursts, not just paralysis. Neuropsychology brings the emotions and the social family aspects to medical neurology, as well as brain functioning to psychiatric concerns. Emotional and psychological concerns are caused by anomalies in the brain structure and brain chemistry. For example, depression is caused by low levels of serotonin, a neurotransmitter in the brain, which affects how sleepy you feel, how productive you want to be, or how much you want to interact with people. Psychotherapeutic counseling is not only treatment for psychological conditions and psychiatric disorders, but also to help one improve the ability to deal with challenges in life, have deeper relationships. It can also help you find more purpose and meaning in life, and learn to thrive during difficult times. It helps you achieve the goals that you have set for yourself but aren't able to achieve them for reasons you don't fully understand. Neuropsychotherapy is the new service that Synapsium has introduced. It moves away from traditional counseling to include holistic interventions based on neuroscience and medical research. Neuropsychotherapy is based on the brain's ability to modify itself in structure and chemistry based on our experiences. In this therapy, we hack the complementary brain body relationship to use our lifestyle to create changes in structure and function and chemistry of our brains, as well as using and understanding our neurobiology to transform our lives. With age, our functioning can change, but we need to learn how to identify signs and symptoms so we can seek help at the right time to reduce the chances of deterioration. The goal is to age gracefully. So, how do we understand neuropsychological rehabilitation? Let's look at the example of a brain stroke. Unfortunately, a lot of us would know or would have heard of people undergoing physiotherapy after suffering a brain stroke, either because of imbalance or for loss of strength in their arms and their legs. We know that a stroke occurs in the brain, but do we know what happens with the other functions of the brain? So, what are the main functions? Memory, attention, language, being able to learn new things, being able to plan your day, even your whole personality, your mood, how angry you get or how interested you are in conversations with people around you. All of these are functions of the brain. So when we think of a brain injury, we cannot assume that these will not be affected. These functions and these injuries are unfortunately invisible. But when we can't walk or people have difficulty staying balanced, those are visible injuries, and hence people associate physiotherapy and are more aware of physiotherapy as treatment after a brain stroke. But what is crucial for us to understand is that the quality of our life is very closely affected by neuropsychological functions, and therefore neuropsychological rehabilitation is very important to include in the treatment plan after somebody has a stroke or any other form of a brain injury. With time, my learning led me to understand that many mind and brain problems and disorders can be prevented. Today, we have neuroscientific, genetic, and metabolic research that shows us ways in which we can safeguard our brain and mind from damage. We can build emotional resilience to safeguard ourselves from depression, anxiety, sleep problems, learn constructive skills to have healthier relationships, and also learn how to build true contentment and satisfaction with life. I began conducting seminars, workshops, interactive meetings, and even organized an international workshop. Awareness talks at various hospitals, clubs, and for several associations, with a training workshop even for our police force. At Hanging Garden, we conducted workshops on the training of mindfulness as a way to change the structure and function of your brain. I feel so proud that our community is becoming more aware of dementia, and a film that I consulted on has actually won so many awards. The most innovative of these awareness campaigns has been the annual Brain Health themed fun fair. It's the only one of its kind where you can experience the different functions of the brain through fun activities. learning to live brain healthy.